On April 14, 2016, the BC Health Officer declared a public health state of emergency in response to a dramatic rise in drug overdoses. This tragic public health crisis has been worsened by the onset of the COVID-19 pandemic. Physical distancing measures have minimized opportunities for gathering and supervised consumption. This, in addition to reduced hours and closure of many services like overdose prevention sites, has increased concerns of people using alone. Since March of 2020, when physical distancing measures were implemented in BC, the number of drug toxicity deaths has been on the rise. In July 2020, there were 175 suspected illicit drug toxicity deaths, the highest ever recorded in a month in BC. Experiential workers, people with lived and living experience of substance use, are at the forefront of overdose response. Experiential workers perform a variety of roles, including distribution of harm reduction supplies, peer witnessing of drug use, referrals to services such as housing agencies, advocacy, outreach work, overdose response, and research. Experiential work can be stressful, with lasting emotional and mental health effects. Despite working in stressful environments, unlike other healthcare providers and first responders, experiential workers usually lack access to institutional or occupational supports. Their experiences can also be impacted by poverty, homelessness, stigma, and discrimination. The peer-to-peer project aims to identify, implement, and evaluate peer-led support interventions that would be valuable and effective for experiential workers. We used a participatory community-based research design where experiential workers are core members of the team. They led 8 focus groups in the Lower Mainland and Vancouver Island to identify support needs of experiential workers. 3 key themes were identified and formed the basis of an intervention model which experiential workers titled ROSE. The R stands for recognition of peer work. O stands for organizational support. S stands for skill development, and E stands for everyone. The ROSE model consists of practical strategies that have been implemented at 2 pilot organizations, Rain City Housing and Solid Outreach Society. R stands for recognition of peer work. Experiential workers feel they do not get the respect they deserve from other professionals and experience community-level stigma. There are multiple interventions under the R arm of the model, including meet and greet events with other professionals, such as police, housing agencies, and paramedics, to facilitate relationship building. We also created a video called #PeerLife, which features a day in the life of a peer. We also created photo ID and business cards to professionalize the role of experiential workers. O stands for organizational support. Many experiential workers highlighted a lack of clarity around their roles and a lack of support in the workplace. We created documents to formalize the role, including job descriptions, recommended pay, a job contract, and an orientation checklist for new workers. A peer debriefing program was also implemented at one of the pilot sites. S stands for skill development. Experiential workers identified several skills that they would like to develop further, including mental health awareness, first aid and CPR, overdose response in light of COVID-19, self-defense, conflict de-escalation, and pulse oximetry. The E is to emphasize that the initiative and all of the resources developed are for everyone. Our team is committed to making all resources publicly available. We are conducting a 1-year follow-up survey consisting of measures of perceptions of health and quality of life, job satisfaction, awareness of interventions, and substance use patterns to evaluate the impacts of the project. Our project consists of practical strategies developed for and by experiential workers that can be implemented by organizations across Canada. Our follow-up survey will inform the impact of our interventions for experiential workers and will form the basis of the recommendations we share. We hope that our research positively impacts experiential workers for generations to come. The success of this project is thanks to the fruitful collaboration between the BC Centre for Disease Control, Rain City Housing, Solid Outreach Society, and UVic's Canadian Institute for Substance Use Research. The peer-to-peer project is funded generously by the Health Canada SUAP grant. If you want to find out more information, visit towardtheheart.com/peer-engagement. We respectfully acknowledge that our project takes place on the unceded traditional territories of the Coast Salish peoples, including the traditional territories of the Musqueam, Squamish, Tsleil-Waututh, Saanich, Songhees, and Esquimalt peoples. This presentation was developed collaboratively by all of the diverse and talented members of the peer-to-peer team. Thank you so much for watching.